for any woman, if you become pregnant, of course there is some change in your lifestyle, but being diabetic, then you would always be very vigilant about your diabetic control with your diet, exercise. Always make sure that I monitor myself at pre-meals, post-meals, and record all my readings, go and attend the clinics regularly. So these were the extra wee things which you do than the normal patients, I should say. So that's the only change.
I didn't have severe morning sickness, so I felt sick at the beginning of pregnancy, probably between about 8 and 12 weeks. I wasn't ever sick, so therefore was able to maintain my food intake and my regular control.
In these first weeks, your baby's major organs are formed. Its nervous system begins to develop, and its eyes, ears and nose take shape. During these early stages of pregnancy, you will need to visit the joint antenatal and diabetes clinic every fortnight, starting in week 6 at the latest, but earlier if possible. Your GP can refer you to the diabetes team, or you can contact the team directly. You should continue taking folic acid until the end of week 12. If you haven't already done so before becoming pregnant, it's really important you adopt a healthy lifestyle and check your medication with your diabetes team. If you have type 2 diabetes and your method of controlling it is by diet or diet and tablets, you'll probably have to start injecting insulin during this period. There are a number of tests you'll be given while pregnant to make sure that all is going well. Ultrasound scans are used to check the baby, measure its growth and confirm the expected date of birth, while a regular HbA1c test tells you how effective your blood glucose control has been over the previous 2 to 3 months. You'll also need your blood pressure and urine checked at every antenatal appointment. You'll also be offered eye and kidney tests if you've not had any in the past 12 months. If you're suffering from nausea and vomiting, you should get advice from your diabetes team.
The blood sugar itself, I don't think the pregnancy has really made it any more difficult. I think the blood sugar was probably always that difficult to control. But I suppose during pregnancy, because you're trying to keep the level that bit lower than before, then yes, definitely it has had an impact on the difficulty and the time and the effort really required to try and maintain a lower blood sugar.
At the start of pregnancy, my insulin level went down, and I believe now, as I get towards the middle of the pregnancy, it will go up again. I've been told by the consultant that the blood sugar will run higher after 20 weeks, so that'll be my next stage now, to have a look at that.
The appointments aren't too bad. I don't mind going up. It's exciting to get different scans and that taken, so I got a scan next week actually, which I'm looking forward to.
In weeks 16 to 28, you can really begin to see your baby grow. It will be beginning to move now, though it won't yet be able to breathe on its own. If you're taking insulin, your dose may need to increase as your baby grows. You'll still be visiting the antenatal clinic every 2 weeks. If eye problems were identified at your first antenatal appointment, you'll be offered further eye examinations. You should also be offered a special scan at 20 weeks to check the development of your baby's heart and other internal organs. From week 28, you should be offered an ultrasound scan every 4 weeks, where the baby's head and abdomen will be measured to check its growth. As some women with diabetes develop preeclampsia, you'll continue to have your blood pressure and urine checked at every visit. Preeclampsia usually occurs in the second half of the pregnancy and can be harmful to both you and your baby. The usual treatment is to bring your blood pressure down with medication and, if needed, a period in hospital.
They always have to have this metabolic clinic, especially for diabetic patients like us. So it gives an opportunity for us to be under control, mainly because you're well aware that you're going for metabolic clinic. You have to take your diary with you with all your readings, and there are all other times when you have not reached the target, there's someone to talk to you, and Even though they give you a lot of information with the diabetes specialist nurse and the education center, you might forget over the time, but because you're being continuously monitored every now and then, you see to it that you do some effort from your side as well. So I think that is good.
At the start, my insulin requirements went down slightly, and as I've gone through pregnancy, the insulin requirements have increased, and now I'm on almost double what I was on pre-pregnancy.
From weeks 28 to 40, your baby's brain grows rapidly. From around 30 to 40 weeks, you'll start to visit the antenatal clinic every week, while between 32 and 36 weeks, your baby will be scanned to monitor its growth. During this period, you may need up to 2 or 3 times your usual dose of insulin. There are other risks during pregnancy. Though the death of an unborn child is more likely with a mother who has diabetes, it should be said that this is very rare and the risk is considerably reduced by good blood glucose control. Even so, if you become aware that your baby isn't moving as much as normal, you should contact your diabetes team or doctor immediately.